Honestly, just right off the bat, I could tell you this is going to be a tough case. Sir, I need you to lay still, okay? Can you hear me? And he's snoring. So, when you do surgery of this type, our patients must be awake in the beginning, and we try to keep them comfortable with some anesthesia, but sometimes anesthesia has the opposite effect. Instead of keeping the patient still, they jerk around and move, and we call it psychomotor agitation. But the point is that anesthesia has sometimes that effect on people's movement, and you just have to be prepared for it. So this patient is large. That makes the surgery much harder. He's had prior fusion. Some surgeon has done 4 surgeries on his back. He's had a fusion at L1-2, L2-3, L3-4, L4-5. They did not fuse L5-S1. That's where his pain is now. And they did not put a cage at the L4-5. So he has pain coming from the L4-5 disc and the L5-S1 disc. We're going to confirm that shortly. But we need the patient to be cooperative and lay still and not move around. Also, it's, the surgery is easier to do when our patients are smaller. But unfortunately, when people have back pain every day, they stop being active and they gain weight because they're not being active. So it's a kind of a double-edged sword to have back pain because it just makes your health worse. And this poor person has been suffering for years with back pain, and nobody has given him the relief that he needs. So we're going to do our best today. But I could tell you he's going to be a level 10 out of 10 to try to do his surgery. So we'll do our very best. First thing I'm going to do is give him some numbing medicine. Now he's on the right side. He's an L4-5, L5-S1. We're going to show you the x-ray in just a minute, and you're going to see all the screws and rods and cages that somebody put in. It's best to avoid fusion surgery. Lay still. All right. I want him wide awake. Let me know when he's wide awake so we can have a little conversation. All right, so first thing I'm doing is I'm palpating for what's called my entry point, where we're going to start and go in. And it's pretty close to where my initials are. Those are my initials, by the way, not the patient's. If you watch our surgery broadcasts frequently, you'll see that every one of them has an AD. That doesn't mean every one of my patients' initials are AD. Those are mine. All right, so because this patient is also very thick, the x-ray pictures are going to be challenging as well. So we have a top-of-the-line x-ray machine, best you can buy, but I can already tell that we're going to have some difficulty with the x-ray. All right, do you want to wake? Is he awake?
Yes, yeah. He's awake.
Talk to him. You're going to have to explain. If he doesn't lay still, we're going to have to cancel the surgery.
Stay still, okay? Good. Keep your head nice and still.
Excuse me.
Nice and still. Nice and still.
Can you hear me? Can you hear me? This is Dr. Deuk. If you keep moving, we're going to have to cancel your surgery.
Do you hear Dr. Deuk?
Do you understand me?
Buddy.
Do you understand me? So I need you to stay still. If you feel pain, just let me know, say ouch, and I'll give you some more numbing medicine, all right? All right. So we're going to try a different strategy where we're going to keep our patient more awake so that he's more in control of his own movements rather than just squirming around. Lay still. All right. We're going to go ahead and get started.
Okay, just
For those of you that watch a lot of these surgeries, you know that most of the time our patients are laying still and doing a good job of it. I can feel the scar tissue.
you're doing great. Keep your head still.
All right, I need you to get 5-1 lined up. So you can see on the x-ray, Henry, are you showing the x-ray?
Yep.
All right, you can see on the x-ray that there's screws at L5. Now we're going to work on getting that disc space lined up. I think you need to go the other way. So this is going to be the first order of business is to get I think that's better. So I think you need to move north with your base. Lay still. If you keep moving, we're going to have to keep adjusting the x-ray position.
Keep your head down.
And we'll never get the surgery done. That looks better.
Okay, my friend.
So
Just
look
keep
at
your head
that
still.
L5-S1 disc space. Jordan's going to show you with an arrow. That's what we want to see. We want to go right through that. We want the end plates to line up. You can show them the facet joints. That's the facet joint in the back. I've got to navigate past that. Show them the screws in L5. There's 2 screws in L5 that the other surgeon put in. Show them the cage at L3-4. See that cage? Now that is a fused bone. Look at the fused bone right there. Jordan's pointing to it. Now look at the next disc that they did. It never fused because they didn't put a cage in there. Very sloppy. Sloppy work. So I don't know if the surgeon had a tea time he had to make, you know, that he had to, oh shoot, I got to go play golf, so I'll just leave a cage out of there. But without the cage, there's still a problem there. Hey, lay still. We're going to do some numbing medicine. Yeah, I'm giving him num-num. That's fine. Shot? We'll do our best. Lots of scar tissue. You really can't numb scar tissue, unfortunately, because the scar tissue is a very dense. Let's see where we are. So we're heading down to the 5